Thank you for those kind greetings. Several years ago, when I first came to speak at Paul Chatlin's Hamlet, 2 years ago, I came to speak at Paul Chatlin's Village. Tonight, I'm speaking at Paul Chatlin's City. So just amazing testimonial to the energy and the commitment of a gentleman and a really caring individual has done for this community. I'm proud to be asked to come. Now look, we got a lot of work to do, so we're going to get right into it. Especially if I can make this magic rascal there. Now, if you're a cardiac surgeon and you decide you're going to hang out your shingle in Okinawa, rural China, the Papua Highlands, Central Africa, the Tarahumara in northern Mexico, forget it. You better plan on selling pencils. They never have heart disease. That's like half the planet. What a huge message that is to us in medicine. But we really didn't get it. Now, this is a slide that I took. This is my oldest slide in the collection, 1968. I took it when I was leaving Vietnam, having spent a year there as a combat surgeon. And it reminds me to share with the audience that when we looked at the autopsies of our GIs who had died in Korea, and at an average age of 20 years, 80% already had gross evidence of coronary artery disease that you could see without a microscope. Not enough yet for their cardiac events. But here at this young age, the disease was already started. Well, now that was looked at further about 45 years later. And lo and behold, this time in this study, looking at young women and young men between the ages of 17 and 34 who have died of accidents, homicides, and suicides. Now the disease is ubiquitous. Everybody. You graduate from high school in this country, and you get a diploma, and you also get the early stages of coronary artery disease. Not enough for your cardiac events yet. But here's where we had a chance to absolutely get it right. This is World War II. The Axis powers of Germany overran the Low Countries of Holland and Belgium, and also the occupied Denmark and Norway. And it was characteristic that the Germans took away their livestock for their troops. So their cattle, their sheep, their goats, their pigs, their chickens, their turkeys, gone. Suddenly, these Western European nations were now plant-based. And it was interesting that Doctors Strom and Janssen, reporting in England's leading medical journal, The Lancet, in 1951, looked at the deaths from heart attack and stroke in Norway during this period. And let's just do this together. So here we are, over here on the left, and 1927, deaths and heart attack and stroke in Norway going up. 1930, going up. 35, going up. 39, income, the Germans. Whoop, 1940, whoop, 41. Who knew these Germans were these great public health educators? Bingo! 1945, the death of Adolf Hitler, the cessation of hostilities in the European theater. Immediately, back comes the meat, back comes the dairy, back come the strokes, back come the heart attacks. But we just didn't get it right. Okay. It's my hope tonight that there will be two words that I use that you will remember. Two words, all right? I'm not going to tell you what they are quite yet. On your right, you're looking at a very diseased artery. And you're probably looking at this opening and saying, boy, when that closes off, there'll be a heart attack. However, only about 10% of heart attacks come from something this nasty. Yes, it's going to cause chest pain. Yes, it may cause shortness of breath. Heart attacks, 10%. Why? Because this has taken years and years and years to get this narrow. And as that happens, the downstream heart muscle that is being deprived of its oxygen and nutrients begins to say, I need more blood, and it begins to build its own bypass. So you will see, often when you do the angiogram, the dye test, you will see these little streaming collaterals flowing around this blockage. The body has often built its own bypass so that when this finally does close off, there'll be no heart attack because those little collaterals are sufficient to sustain the downstream viability of the heart muscle affected. But now let's go over here to the left. Here's a normal artery. And even those of you in the back can see this tiny little dark line. And here's the first word I want you to remember. That tiny little dark line is called the endothelium, made up of endothelial cells. And they are really quite magical, as we'll see shortly. The first thing that happens when you're eating the milkshake, the cheeseburger, the pizza, things get sticky, sticky, sticky. Your cells are not coursing through your blood vessels smoothly. Everything has gotten kind of sticky. And here, I know you've been waiting for this, from Harvard. Even though I went to Yale, it's okay. We definitely recognize contributions from Harvard. To orient you a little bit, here in the blue, up here in the blue area, is the flowing blood. Here you see these little purple endothelial cells which separate the flowing blood from the wall of the artery. Now, to make sense of this together, let's start again in the upper left. Here these orange LDL cholesterol particles are. They're sticky. They bump up against the sticky endothelium, which has probably got a crack, a fissure, an opening because of this lousy American diet we've been eating. And the LDL cholesterol migrates into the subendothelial space where it rapidly becomes oxidized by free radicals, many of which are from our diet. Now the artist has made them all yellow. Now the subendothelial space does not like these small, hard, dense yellow LDL particles and calls upon our SWAT team, our white blood cells, which here Peter Libby of Harvard has painted blue in honor of Yale, and we like that. But it behaves like Pac-Man. Here it is, gobbling up, gobbling up, gobbling up all these small, hard, dense LDL oxidized particles until it gets all the way over to here. When we in medicine do what we do so often, we change the name. It now is a foam cell. And the foam cell is truly the Darth Vader of this sequence of events. Why? Because the foam cell elaborates and manufactures these nasty, nasty substances we call metalloproteinases. And what do? The metalloproteinases are enzymes which will progressively erode the cap. The cap over the plaque, especially up here, gets thinner and thinner and thinner until it gets so thin that the sheer force of blood racing over it tears it. Now you can see we've got a rupture in the cap over the plaque. You have ruptured your cap, and now you have extravasation, or the oozing out of, if you will, of plaque content out into the flowing blood. When it does that, it's highly thrombogenic. highly likely to cause a clot, as you can see in the next picture. Now the clot is forming where the plaque is ruptured, and the clot is in and of itself self-propagating. So in a matter of further minutes, bingo, suddenly an artery, which was only blocked by 35%, you never begin to get symptoms till you're over 75% blocked. Here it is, totally blocked, and all the downstream heart muscle is now deprived of its oxygen and nutrients. It starts to die. That's 90% of your heart attacks. Now, if I do my job correctly this evening, every one of you, and hopefully your friends and relatives, can make themselves heart attack proof. How are you going to do that? You're not going to do it with another drug or a pill. You're not going to do it with a procedure. You're not going to do it with an operation. We're going to do it by changing your biochemistry. How are we going to change your biochemistry? By getting you to eat whole food, plant-based nutrition, okay? Pretty exciting stuff. That it can be done without all those gadgets and all that technology. Now, forget the x-ray here, but I want you to focus on the artist. He has drawn an artery. Half of it is blocked with plaque. The other half is still opening. Do you know what those little cells are that I just mentioned to you lying on the inside? Yeah, the endothelial cells. Now, up until 1980, we used to always think of the endothelial cells as these cute little red bricks that were lining our pipes, our blood vessels. That all changed in 1980. In 1980, Dr. Furchtgott, working in Brooklyn, was taking the largest blood vessel in the rodent, the aorta, and he would do this sort of elliptical spiral staircase cut on it, and then he would immerse it in a bath of saline, and it would constrict. But one day, no cut through the endothelium. Immersed it, it dilated. Did it again, it dilated. Now suddenly, globally, the race was on to discover what was the EDRF that Dr. Furchtgott had discovered. Endothelial derived relaxation factor, kind of rolls right off your tongue. Thank heavens that term was with us only 8 years. In 1988, Dr. Furchtgott, Lou Ignarro, and Dr. Murad discovered that the EDRF was a gas. And the gas was called, and this is the second word that you're going to remember from this presentation, nitric, not nitrous, nitric oxide, okay? So we have the endothelial cells manufacturing nitric oxide. And what makes nitric oxide so special is its functions. What are the functions of nitric oxide? Because those three men got the Nobel Prize in 1998 for that discovery. The functions of nitric oxide: one, it keeps all those cellular elements within your bloodstream really going smoothly, like Teflon. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed, protect you from getting high blood pressure or hypertension. Number four. Now, number four is the absolute key. A safe and plentiful amount of nitric oxide will protect you all from ever developing blockages, or plaque. Now, that means that anywhere on the planet Earth, whether it's in London, Berlin, Chicago, New York, or Detroit, if there is heart disease, it is because by now, in the previous decades, you have so significantly trashed, injured, compromised, and turned your endothelial system into a train wreck that you simply do not have enough nitric oxide to protect your cells from getting blockages or plaque. Well, what are the foods that every time they pass your lips, you further injure your endothelial cells? Okay? We're going to find out about that in a minute. The other thing that was so important that happened about this time is that Dr. Vogel, Robert Vogel, chairman of cardiology at the University of Maryland, took a healthy group of young subjects to a certain fast food restaurant. Half the group got the cornflakes, the other half got the hash browns and sausage. Now, I've just shared with you the functions of nitric oxide. As I look out at this audience, I can see that any number of you are sort of saying to yourselves, I wonder what my level of nitric oxide is. Well, we don't really have a handy way that physicians have in their office to do this. There is an expensive machine that can do it. But from a research standpoint, the way you measure nitric oxide is the brachial artery tourniquet test. Take an ultrasound probe, place it over your brachial artery at the elbow. There's the readout diameter of the artery. Then for 5 minutes, you encircle the upper arm with a blood pressure cuff, which you inflate above systolic blood pressure, so that for 5 minutes you have absolutely zero blood flow to your forearm and hand. Now, I've had that done. It's not exactly habit forming. And then you immediately release the cuff and remeasure the new diameter of the brachial artery. In the normal individual, it'll be 30% greater from all the outpouring of nitric oxide from the time when that tourniquet was on. So let's go back to Robert Vogel's experiment. Half of these healthy young subjects went to this McDonald's and had cornflakes, brachial artery tourniquet test, normal. The other half who had had the hash browns and sausage, 120 minutes after ingesting that food, brachial artery tourniquet test, they couldn't dilate the artery. That single meal had so trashed, so injured, so compromised the capacity of the endothelial cells to make nitric oxide, they didn't have enough. They didn't have enough to dilate the artery. Now, as they followed them into the late afternoon, early evening, they began to recover. But you and I know. The next morning for breakfast, scrambled eggs and bacon. Lunchtime, cold cuts with mayonnaise and white bread. Supper time, baked potato with sour cream. Lamb chops, vegetables soaked in butter, and ranch dressing on your salad, and ice cream for dessert. Here, throughout all of 24 hours, you are striving to destroy your endothelial capacity to make nitric oxide. Okay, pretty exciting stuff. Now, I want to emphasize this a little bit for a moment. You can mimic what I'm doing if you want, but let's just say that if I put my hand here like I'm shielding my eyes from the sun, that's the level of nitric oxide that you have when you are 8 years old. How many of you have ever heard of an 8-year-old having coronary artery disease and a heart attack? That's your nitric oxide level there. Now you're 23 years old. And sadly, you get run over by a bus. At autopsy, even though your nitric oxide level is lower, it's low enough so that at autopsy they find that you've got plaque in your arteries. Not enough for your cardiac events. So here you are at age 20 with already a plaque. Now it's down at your navel. You're 48 years of age. I get a phone call. Dr. Esselstyn, you would be proud of me. Ever since my heart attack, I've been following your program 90%. I have no idea whose program you are following. I do not have a program where after somebody has so destroyed their endothelial capacity to make nitric oxide that they have a heart attack, and then they tell me that from there on, 10% of the time, they're still going to strive to further destroy their remaining endothelial cells so they can line up and have a second heart attack. Okay, got it? Now, the exciting thing is, this is not a malignancy. This is not an infectious disease. And what we have shown time and again is that you can restore the capacity of the endothelial cells to make enough nitric oxide so that not only can you halt disease, but often we will see elements of disease reversal. Here, just a quick summary of what nitric oxide does. And, often 4 or 5 years ago, until I got smart enough to this, I'll ask patients how they're doing with the diet, and they'll say, doing pretty well. Pretty well? No, this is Dr. Esselstyn. What's pretty well? Well, pretty well is, I go to a restaurant and I just can't be sure whether they got rid of all the oil. What? Why can't you be sure? What you tell the waiter or the waitress when you go to a restaurant, you look them in the eye and you tell them you are deathly allergic to a single drop of any oil. No oil. Okay. If that doesn't, then they pick up the menu with you and they start going through stuff. Nothing. It's all oil. So you politely ask, could I speak with the chef? Tell the chef that that you can't have any oil, animal protein, sugar, or dairy. He says, fine. He'll be back in 23 minutes. You get beans and rice, or you may have a baked potato with some vegetables, or if you're not in a great hurry, or you're not very hungry, you ask for the large salad, and from your purse, you bring out your own salad dressing that does not have any oil. I never accept the excuse that I couldn't help it there. What do you mean you couldn't help it? What would happen if you missed a meal? 2 meals, 3 meals. Great, your endothelial cells would sparkle. Okay. Now, tonight, first of all, I want you to know that all 4 of these marvelous molecules are very protective and defensive against heart disease. Tonight, we're really going to spend time only on the endothelial cells. That's all we got time for, but I want to share with you this. When you are eating whole food, plant-based nutrition, every one of these marvelous defense factors becomes optimized. Okay, good. All right, now let's get to the thick of it. This is the first study that I did, 1985. Small, because I was still actively involved as a general surgeon. And this small study of these 24 patients, the idea was to simply make sure that they did not have one morsel of food that was going to seriously injure further their endothelial cells. These patients were made up of those who had failed their first or second bypass, had failed their first or second angioplasty, were too sick for these procedures, or they had refused. 5 were told by their expert cardiologist they wouldn't live out the year. They made it for 20 years. Now, What are the foods that I wanted to eliminate? Not a drop of any oil. Olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in the cracker, oil in the piece of bread, oil in the salad dressing. No oil. Or anything with a mother. No meat, fish, chicken, fowl, turkey, and eggs. And no dairy. Milk, cream, butter, cheese, ice cream, and yogurt. And no sugary drinks, diet colas, Pepsi or Coke. And no sugary foods. Cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. I don't like, in patients who have heart disease, I don't like them to have the avocado, nuts, peanut butter, or cashew sauce. And certainly no coffee with caffeine. Decaf? Yes. Tea with caffeine? Okay. Everybody get that? Kind of fun, isn't it? Because you know that these are the foods that injure your endothelium, and you want to get all that nitric oxide. When you think about it, coronary artery disease is a nitric oxide deficiency disease. Okay. Olive. This is a peer-reviewed scientific study, so you know I'm not bluffing you. Olive, soybean, and palm oil intake have a similar acute detrimental effect over the endothelial function in healthy young subjects. No oil. Now, when you get into a discussion with people who are ketogenic diet or paleo diet or Atkins diet with all that meat, here's the bottom line. This is the work of Stan Hazen from the Cleveland Clinic, and what he did was looked at, these are the foods that omnivores eat, who are eating animal products, okay? Now, what he found was that an omnivore contains in their microbiome, in their gut, bacteria which are able to metabolize these animal products, which contain lecithin and carnitine, into a molecule called TMA, trimethylamine. And trimethylamine is very rapidly oxidized by your liver to trimethylamine oxide, which is nasty and injures your blood vessel. Here is the schematic. Lecithin and carnitine metabolized by your gut bacteria, if you are an omnivore, into TMAO, which injures your blood vessels. But the exciting thing, when Stan Hazen took people who were fully plant-based, fed them a lamb chop, measured their blood for TMA, 0. What? Yeah, but people who are plant-based do not contain bacteria in their gut, which is going to metabolize the lamb chop into TMA. However, if you're plant-based and 4 days in a row, you have that lamb chop, now you have converted your bacteria to the mischief makers. Yeah. I'm going to give you just a break from heart disease for a moment because it emphasizes a point. This is a result of October 2015. The WHO, the World Health Organization, believe it or not, agreed, all these different countries come into an agreement that it was now time to label red meat as the same level of carcinogenicity as smoking cigarettes. Okay. So, back to the study. What are you going to have these people eat? They're going to eat whole grains for their cereal, bread, and pasta, 101 different types of legumes and lentils, all these marvelous red, yellow, and green leafy vegetables, and some fruit. Now, what we have added in the last 8 years, and it is not in my book, if I can take a patient with heart disease and get them to imagine shrinking their head to a size they could crawl inside their coronary artery and see the blockage, it would be an absolute cauldron of oxidative inflammation. So we need antioxidants. But don't go down to the health food store and buy a jug of pills that says antioxidant, because it doesn't work and it's going to probably be harmful. I ask you to get your antioxidants from food. Fair enough. What food? Food that is high in what we call ORAC value. ORAC, oxygen radical absorptive capacity. So if you're having raspberries, blueberries, strawberries, and blackberries on your morning oat cereal, terrific start. However, nothing can trump the antioxidant value of green leafy vegetables. So I now need these patients with heart disease to chew, not smoothies, not juicing, to chew a green leafy vegetable roughly the size of 3/4 of their fist 6 times a day, 6 times a day, after it has first been boiled in water or steamed, 5.5 to 6 minutes, so it's now nice and tender. And then you must then anoint it with several drops of a delightful balsamic vinegar. Why? Because the acetic acid in the vinegar has been shown to restore the nitric oxide synthase enzyme in your endothelial cell that is responsible for making nitric oxide. That's what we want, nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich, that's 3, mid-afternoon, 4, dinner time, 5, and God, I adore it when you have that evening snack of kale. 6. What are you doing? All day long, you are basking and bathing that horrible oxidative cauldron with nature's most powerful antioxidant and making more nitric oxide. But the second thing that chewing the greens does, it stimulates your bone marrow to produce more endothelial progenitor cells. What are the endothelial progenitor cells? They replace our senescent, injured, worn-out endothelial cells. And the third thing that chewing the greens does, when you're chewing a green, you are chewing a nitrate. As you chew that nitrate, it mixes with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the nitrate that you're chewing in your mouth to a nitrite. Now when you swallow the nitrite, your own gastric acid is further going to reduce the nitrite to more nitric oxide. So here you are, with no added expense, with no horrible side effect. All day long, you are absolutely restoring that very molecule that you were deprived of. Pretty exciting. All right. Now, no oil! All right. I want to show you several angiograms of disease reversal. This is a 67-year-old retired pediatrician, and I should add that all of these angiograms were reviewed in triplicate in the Cleveland Clinic Angiography Laboratory by senior technicians that do this all day long for national medical trials. So when I give you a % of change, I know it's accurate. In this one, this is the left anterior descending coronary artery, the widowmaker. From here over to here was described as a 10% improvement. A little easier to see in this next one. This is the circumflex artery in a 58-year-old factory worker. This is described as a 20% improvement from here to here. On this is a 54-year-old with security guard. The right coronary artery, this was described as a 30% improvement from here to here. This is Joe Crow, a surgical colleague of mine at the Cleveland Clinic, 1996. 1996, Joe Crow began to get chest pain, pressure, and cholesterol was 156. He was not a smoker. He was not hypertensive. He was not diabetic. Regularly exercised. No family history. Chest pain. In October of '96, cardiology worked him up. Could find nothing. In November, the third week in November, he finished his surgical schedule. He sat down to write postoperative orders. And suddenly, the elephant was sitting on his chest, pain in his jaw, shoulder, having a heart attack. Whipped down to the cath lab. They start the catheterization. Cardiac arrest, resuscitate. Finish the catheterization, one more cardiac arrest, resuscitate. Back up to his room, stabilized, and 3 days later, discharged. And he was very depressed. Why was he depressed when he was discharged? Because at the time of his angiogram, they looked at his artery, and it was all, the lower third of his left anterior descending, the widowmaker, was all moth-eaten and diseased over too long a segment to just sort of smash in stent after stent after stent, and it was too far down the artery for a bypass. So he was very depressed. So Ann and I had Joe and his wife out for a supper 2 weeks after his heart attack. Joe, come on. You've been eating this crappy American diet, and you've got the typical disease. Why don't you think about going plant-based? We've now got 10 years of data. Okay. Yes, I'll give it a shot, but I'm not going to take any of those statin drugs. I don't trust them, and there are too many side effects. Fine. That's your call. Not a problem. He became the absolute personification of commitment to whole food, plant-based nutrition. And over the next 2.5 years, his total cholesterol plummeted, his LDL went from 98 to 38. Then he had another angiogram. And up in the surgical office areas, our doors are 3 doors apart. So at noontime, on the day that I knew earlier that morning he had his follow-up angiogram, I went over, opened the door to his office, and there he was sitting behind his desk. Joe, I understand you had the follow-up angiogram. Mind sharing with me, how did things go? Well, he had a couple of these. I think we're doing okay. All right. Well, Joe, would it be okay if I could see the angiogram? And he said, sure. Now, that's not going to happen to everybody. When the plaque is young and soft and made up of fat and cholesterol and inflammation, the body has a tremendous capacity to shrink it and make it smaller and reduce it. But perhaps for 70-75% of patients who have an old plaque made up of scar and fibrosis and calcification, it's probably not going to move very much. But nevertheless, even those patients with plaque which are not going to remove should be able to get back to full activity of daily living without restriction. And it's going to be my responsibility tonight in front of you to explain scientifically how it is that happens. Kind of exciting. All right. Now, despite my sparkling personality, there were 6 of these original 24 patients. I knew within the first month they didn't get it. I had no money for this study, so I returned them full-time to their expert cardiologists, and they became sort of my quasi-control group. And they had, over the next 12 years of follow-up, those 6 patients who dropped out, 2 died, and the other 4 had to have another bypass. On the other hand, the 18 who stayed with us, it was interesting that I wanted to know, in the 8 years prior to coming into our study, while they were in the hands of expert cardiologists, how many increasing coronary events of worsening disease did they experience? 49 in these 18 patients, as you see here, dispersed among the various categories that are found. However, once those 18 patients came into our study, over the next 12 years, 17 of those 18 had no further events. And at 6 years, we did have one little sheep who wandered from the flock, got into the lamb chops, French fries, had more pain, got a bypass, but now he's back with the flock. But proves the point that I'm trying to share with you today. All right. Now, proud and as excited as I was about the fact of what we had shown, and boy, this was tough to get other people to pick up the mantle. I'm an enormous threat to medicine's biggest cash cow. And it said, Dr. Esselstyn, your diet is ridiculously strict, and nobody will follow it. And what makes you ever think you could repeat this and get similar results? So we did. And in July of 2000, this is a study that was published in the Journal of Family Practice, some 200 patients, and it's interesting. What I was most keen about was this 89.3% of adherence, almost 90% adherence. Why were we getting 90% and they are unable to get their patients to change? Here's the key. If you're going to have somebody make a lifestyle change, you must, whenever possible, you must be speaking with the couple, patient, wife, or patient and significant other. Both parties have to know, and you must show the patient respect. The only way that I know to give a patient respect is to give them my time. So if you think you're going to change your patient's lifestyle, speaking with them at a 10 or 12-minute office visit, you're smoking something. That's not going to happen. That's not going to happen. But we have a program once a month where I counsel usually somewhere between 12 and 16 patients, always with their significant other or spouse. And in that 6-hour period, they're going to learn all about what we've just sort of scratched the surface of here with you tonight in detail. They're going to know exactly what the endothelial cell is. They're going to know what nitric oxide is. And they're going to learn how they can give up food that looks delicious, smells delicious, tastes delicious, that is destroying their health, for another pile of food that looks delicious, smells delicious, tastes delicious, that is going to enhance their health. And very few people, when they come through our program, are going to look at me as they're leaving the program and say, well, Dr. Esselstyn, that was certainly fascinating about the nitric oxide and the endothelial cell, but my wife and I are going to be celebrating our 35th anniversary next week, and I can't wait to destroy more endothelial cells. What? Anybody with a brain in their head, when they've had 6 hours with us, they really get the message right. And I should add with you, 2 weeks before we have the seminar, my secretary will give me a list of the patients who are coming with their phone numbers, and I'm old-fashioned enough that I insist on personally calling each of them myself so I can get my arms around their story and at the same time give them an opportunity to ask questions of me, so that coming to this seminar we have a strong platform from which we can all move forward. Now, you might wonder, how do you know these patients were sick? 119 of them had already had stents or bypass. But we're particularly proud, and another 44 had already had a heart attack. I'm particularly proud and interested in this group. 27 had been told they had to have a bypass or stent. After they saw us, they never had it. And we're at the point now where I think that practically anybody, let me correct myself, if somebody's in the middle of having a heart attack, there's no question that a stent or bypass can absolutely be life-saving. But when those stents are offered electively, the data are also clear. There is no prolongation of life, and there's no protection from a future heart attack. Those are the data. Now, how many were there? There was one patient out of the 177 when he was traveling in China, totally misbehaving, eating off the economy, had a tendency to hypertension, had a small stroke right here. The 21 patients who were not adherent, 62% had follow-up disease progression. Now, I wanted to therefore test our results with some of the best studies that we see in medicine with a conventional approach. This line up here, all right, this is major cardiac events on the left, heart attack, stroke, or death. Here we have, far right, the Lyon Diet Heart Study. At the end of 4 years, 25% heart attack, stroke, and death. Columbia Presbyterian Hospital, New York City, Natural History of Coronary Disease, 20% heart attack, stroke, and death at 4 years. Bill Bowden's Garage Study, 19%. So somewhere here between 21, 22%, 30-fold difference. Here we are, 0.6%. What is the difference between our approach and standard cardiology? We are teaching the patients about disease causation. Ever since the days of Hippocrates, there's been a basic covenant, a covenant of trust between the caregiver and the patient, that whenever possible, the caregiver will share with the patient what is the cause of the illness. And sadly today, in cardiovascular medicine, that's still not being done as it should. And I have the greatest respect and admiration for my cardiovascular colleagues, but 4 years ago, I was asked to join the American College of Cardiology Nutrition Committee. Why? We are trying to educate cardiologists about nutrition, which they've never had education about it, either in medical school or significantly in their postgraduate training. All right, now this same month, in July of 2017, I wrote a paper on 3 patients. Now, what right did I have to write about 3 patients? Then think that a journal would accept it, because these 3 cases were the absolute personification of the calamity of present drugs and technology in medical practice. For instance, the first is a fellow that I have yet to meet, although we've been in touch, from Newfoundland, Canada, age 44, Bob Mercer, totally closed off his right carotid, had a mild stroke. At the same time, he had such severe angina, but found a courageous surgeon in Toronto who would operate on him, even though he had a totally blocked artery to his brain, and he got a wonderful result. And by age 70 was when I first became aware, because at age 70, he was now in trouble. His angina had returned. He had gained 40 pounds. He was diabetic. He had erectile dysfunction. And his one remaining carotid artery was now 90% blocked. Of all things to happen at this moment, his daughter, age 37, heart attack. And during her convalescence, she found a book, Prevent and Reverse Heart Disease, and said, "Pop, we got to do this together." They did. So the first time I heard from Bob Mercer was he sent me a letter a year after they'd been on our program saying, "Dr. Esselstyn, I want to thank you. My angina has disappeared. I've lost 40 pounds. My diabetes has disappeared. My erectile dysfunction has disappeared. And my one remaining carotid artery, which was 90% blocked, is now 67% blocked." And here's a picture I take of Bob before and after. Now, this next is Art Soteros. And Art, at age 32, became diabetic. He was overweight. By age 42, came to the Cleveland Clinic and had the first of 14 stents, okay? 14. And then he was told, "You have this aggressive disease, you'll have to have a bypass." So he had the bypass. That was good for 14 months. Then he was told, "You can't have these interventions. You'll have to see what you can do with drugs." He was only 48 years old. And he didn't want to die. A fellow parishioner told him about our program. He came, he was totally compliant, lost 40 pounds, got rid of all his angina, and was doing absolutely beautifully, so that we had him regularly come and present his results at our seminar. But then something happened. Art fell in love. And he was somehow embarrassed to have his fiancée think that he wouldn't eat out at restaurants, which he began doing with impunity. And he had a recurrence of his discomfort, and just that last fall, he had to have 7 more stents. But proves the point that I'm trying to share with you. And the other is Jim McNamara, age 55, small stroke. They tried to operate on the artery, it failed. Then he began getting this pain in his calf when he walked. And he kept, when he tried to go to sleep at night, if it was up in the bed, it would get this tremendous numbness and tingling. He would try to hang it over the bed, get better circulation. And finally, his wife found out about what we did. And Jim came on board. He lost 40 pounds, got rid of his pre-diabetic state, and now walks for 45 minutes nonstop. Here he is dancing at his daughter's wedding. So, summarizing, there's no, as opposed to stents and bypasses, no mortality with the diet, no morbidity with the diet. The benefits improve with time. And for those poor patients who've had a previous heart attack, who are walking around today with the sword of Damocles hanging over their head, when do I get my next heart attack? Nonsense. You never have to have another heart attack. Right. Okay. Now, we know what's the good of having a great heart if your brain isn't there, all right? We know from studies of dementia that in Sweden and in this country, by the time people are 85 years of age, 50% will have dementia. It's a hell of a reward for a lifetime of hard work. Now, we learned a lot about this from the work of Megan Leary and her team from the West Coast, who in 2001 at the stroke meetings in Miami had looked at over 5,500 MRIs of the brains of Americans. And what they begin to see at age 50 are these tiny little white spots, which are what? Little strokes. But you know, age 50, big brain, tiny stroke, not a problem. However, you blink your eye, you're no longer 50, you're 65. More often than before, you say, sweetheart, where'd I leave the car keys? Not a problem. You blink your eye, you're 75. Now you say, sweetheart, where'd I leave the car? Blink your eye, you're 85, you look at her and you say, are you my sweetheart? You don't suddenly wake up on your 85th birthday with dementia. You work hard in all those preceding decades to lay the foundation for that dementia. Now here is what we call a normal MRI. Here I once counted 90 of these little strokes. Can you imagine a message going through that scar tissue? Now here, in this left, the brain is right out to the skull. Here, the brain, whoop, what's this? This is cerebral atrophy. You don't want cerebral atrophy as you get older. Cerebral atrophy. What do you do for that? Exercise. If you're going to walk 5 or 6 times a week, fast enough almost to break a sweat, or bike, or swim, you enlarge your hippocampus, memory, frontal lobe, executive thinking. Pretty exciting what exercise can do. Here's another exercise on the left. Here is a thigh muscle, 40-year-old triathlete. Upper right, thigh muscle, 74-year-old couch potato. Lower right, thigh muscle, 70-year-old triathlete. Quite a message. Now, what you're seeing on the left is the pulse volume. At the ankle of one of my first patients, when he would cross the skyway to my office, he'd always get this pain in his calf, so he had to stop 5 times. And I was so focused on his heart, I forgot all about his leg. 11 months into the program, he said, Dr. Esselstyn, you recall when I first started seeing you, I was stopping 5 times crossing the skyway to your office? Yeah. He said, you know, the last month, it got to be 4 times, then 3, then 2, then 1. I no longer stop. The pain is gone. Don, back you go to the vascular lab. And now on the right, bingo! It is double what it was. Now this was a eureka moment for us because this was when we first started this study. And we now knew that with rock solid, irrefutable science, that food and food alone could restore and reverse cardiovascular disease. And you're going to say, wait a minute, what about the statin drug? Well, wait a minute. This is 1986. We did not have any statin drugs. So I've given you tonight 2 examples. Dr. Crow refused statins. Don, they weren't invented. The persons who can't take statins or won't take statins or are miserable with the side effects should in no way be precluded from enjoying these benefits of being able to halt and reverse their disease, provided they completely make this type of transition. Now, here's another 78-year-old retired high school chemistry teacher. And you can see he and his wife, in their retirement, loved to enter these square dance contests. But during the fast square dance, he was always getting bilateral calf pain during the fast square dance. So he saw these vascular surgeons. They got the image that you see here showing how much disease there was. He didn't like the idea of the big operation they had suggested for him, so he came to see us, and during the counseling he said, Dr. Esselstyn, if I choose your method, how long will it take me to get rid of my calf pain? So I looked at him with great wisdom in my face. And I said, probably about 10 or 11 months. 3 months later, I got a phone call. Dr. Esselstyn, you do not speak the truth. The pain is gone. All right. Now, when I come to a place like Michigan and Detroit, and I look out at the audience, I have some idea that many of you are probably from this Detroit area, but some of you, I understand, have come from outside the Detroit area. So I should share with you. I don't know what it's like when you're watching a sporting event or a mystery, but in Cleveland, when you're watching a sporting event or a mystery, just before the advertisement comes on, you will hear the mellifluous tones of the advertiser say something like, when the moment is right, will you be ready? Now, we all know that the penile artery is really quite tiny compared to the coronary artery. However, all is not lost, but we know that before people come down with heart disease, some or many people will find they are no longer able to raise the flag. However, all is not lost. Not infrequently, 10 or 11 months after I've counseled somebody, I'll get a phone call. Dr. Esselstyn, I really thought I ought to give you a phone call because recently something has come up. And I'm wondering if I don't owe you another check. All right, now here, this is the patient. Remember we talked about somebody who has the plaque? I promised you I'd try to clear that up. Somebody who has the plaque in the artery that is made up of scar and fibrosis and calcification, and it won't go away. How do they do? Now here's what we call a PET rubidium dipyridamole scan, PET scan. This happens to be in a 67-year-old downtown Cleveland stockbroker, cholesterol 248. Here on the left, if it is orange or yellow with this perfusion, that's good blood supply. Here where it's green, it is lousy. That's poor. I counseled them here. 10 days later, his cholesterol is 137, and 3 weeks later, we repeat the PET scan. Bingo, it's all back. Nobody has washed out a plaque or a blockage in 3 weeks. Why is that blood supply back? Now that is the heart without any muscle. And you are going to remember the coronary artery that is E-P-I, epicardial, means it's riding on the surface of the heart. That's where all the major arteries, like your right coronary artery, your left anterior descending, and your circumflex, they're riding on the surface of the heart. They get all the stents, they get all the bypasses, they get all the publicity. But I called Rodriguez, who is our Cleveland Clinic cardiovascular pathologist, and I said, he happens to dissect 200 hearts a year. Rod, how often, once the artery has dived where it's supposed to go, they all dive into the muscle, heart muscle. Once the artery has dived into the heart muscle, how often do you see plaque or blockages? His answer? Never. Once in a great while in a severe diabetic. Other than that, never. Now I think I had the answer. Because when we first see these patients, remember, they have absolutely squashed their endothelial cells down flat. They're making hardly any nitric oxide, the great dilator. And now your endothelial cells have become your enemy. Because when they're so beaten down, they are making two molecules, endothelin and thromboxane, which are what? They are vasoconstrictors. Your endothelial cell, which is supposed to widen your artery, is putting out these vasoconstrictors and very little nitric oxide. So, what happens? This entire cascade, all these thousands and thousands of interlacing arteries that you see here, these small vessels, they are all vasoconstricted. Vasoconstricted. Pinched. They don't have a blockage, but they're pinched. And how does it open so fast? Because once they stop any further injury to their endothelial cell, once again it starts making nitric oxide, and it stops making the vasoconstrictor. So you end up in 1 to 2 weeks opening up again this entire vast cascade of intramuscular blood vessels, which is a huge amount of blood. If you recall in physics, Poiseuille's law of flow through the hollow viscous is related to the fourth power of the radius. Translation, tiny increase in diameter, huge increase in flow. So that's pretty much the story on that. And these are the 6 ways you can get disease reversal, measured. We talked about, I showed you the angiograms, it happens on a stress test. I showed you the PET scan. We talked about the carotid ultrasound and the pulse volume on the leg, and then the 3 symptoms of angina, claudication of the legs, and erectile dysfunction. Actually, almost literally 8 ways that you can reverse disease. Now, I always like to wind it up, because I know not all of you have come to Cleveland, so I thought it was important to let you know what the trees look like in Cleveland during February. I worked for many years as a surgeon on the 8th floor of this building. And then I retired from surgery and I got to work at the Cleveland Clinic Wellness Institute. Now the Wellness Institute is really quite exciting because the budget is more modest than it was previously, and yet nevertheless the morale is quite high. And one thing I've learned oh, geez. One thing I've learned in the 58 years since I've left medical school, nobody's calculating. Yes, brains are important, but nothing is as important, really, as persistence. best exemplified by this young damsel. Life magazine, 1939, trying to learn how to do the splits, and sure enough, the other day in downtown Detroit, Paul Chatelain spotted her, and she got it right. Now, I wanted to finish up by simply saying, not only is it a delight, and am I proud to be here with you again, however, I guess the thing that really keeps me so impassioned about medicine, 20 years since I retired from surgery, and that is that I really see ourselves at what could be a seismic revolution in health, which is before us. And this seismic revolution in health that is before us will never take place with another pill, another drug, another procedure, or another operation. The seismic revolution that is before us will take place when we in the profession and people like Paul Chatelain have the will and the grit and the determination to share with the public, indeed, what is the lifestyle, and most specifically, what is the nutritional literacy that will enable them to absolutely annihilate chronic illness. Thank you.